Hi there, this is Lois Gidika and I am doing this video from Calgary, Alberta, Canada. The purpose of today's video is to advocate for our essential service workers in this war of COVID-19, because this is a war. This is a battle. We are in a war zone with this COVID-19. It's the menace that we are all trying to fight. We cannot see it, but it's out there, it's lurking out there. And guess what? Our essential service workers are our frontline staff. They are there, they're working, it's their civic duty, and they are at risk each and every day. So, I'm not monetizing this video. I do not want to get anything from this video. The only thing that I want to get from this video is the life of a loved one. It's the saved life of a loved one, of a friend, a neighbor, someone in my community who is an essential service worker. You know, a lot of jobs were categorized as essential services, especially those in healthcare and all the other services that we must get. And other jobs were closed. People were asked to work from home. But that is the people who have the privileges to work from home. Not everybody has that privilege to VPN, to remote desktop, to do all the fancy work from home. Our essential service workers, they don't have that privilege. They don't have that luxury. They must go out there and put their lives at risk every day, each and every day. It's their civic duty. You know, I've never been in a battle or a war for that matter. But I know when you're sending your troops to battle, when you're sending your troops to war, you train them, you prepare them mentally, physically, emotionally, their families, everything. And they sign up to go fight for their country. They know that when they get out there, they could either live or die. They have the hope of living, but they know that death is an outcome, and they sign up for that. And that is why we give them ammunition and protection, body armor, everything. They are armed. That's why they are called our armed forces. Those are the people we send to war. In this 21st century battle, the COVID-19, guess who our troops are? Our troops are our essential service workers. Because those are the people who are going out there. They are either fighting it in hospitals, everywhere, or they're making sure that we who have the privilege, the luxury to stay home and work and get benefits from the government, or still get paid by our employers for staying home. They are doing it for us. They are our troops. Our doctors, our nurses, healthcare practitioners, people who work in community services, in group homes, support workers that must support their clients, transit workers, truck drivers, and people who are working in our grocery stores. Those and many others, the police force, everybody who has been categorized as an essential service provider. Those are our troops. My question is, have we done the best? Have we equipped them for this battle? Have we prepared them? Have we given them the ammunition? Because I personally feel that they are out there. They're scared. They don't have protection. They don't have masks. They don't have sanitizers. They don't have anything. They just have fear and a prayer. And guess what? Their families are dead scared as well. You know, there's so much we can do for positivity. And we're staying positive. We are praying. We are interceding for our family members. Yes. we are staying positive for them. But we are all sitting ducks. Everybody in my community, you're watching this, you know someone who is in the essential service industry. It's either your loved one, your friend, your relative, your neighbor, somebody. You know somebody. Are they prepared? Are they protected? It is very frightening when you know that your spouse, your mom, your dad, because these people, they are brothers, their sisters, their mothers, their fathers, their relatives, their loved ones. Every time that they leave the house, they don't have any mask, they don't have anything, we don't know where to buy these things because they are not available in stores. And you know that, you know what? They're just risking their lives. They have nothing. They're just hoping they do not get it. And this thing, they hope they don't get it. We can't see it. It's a menace that we cannot lay our eyes on. So we don't know where it is. It's out there lurking, waiting to devour us, to devour them. But guess what? They have no protection. Apart from the doctors and the nurses and the healthcare professionals in hospitals, those ones have PPE. Everybody else, they do not. They do not have protection. And guess what? The employers are not providing. I don't know if there's any employer out there who is in grocery stores especially. I don't know if we have them who are providing masks. In transit, I want to know, is the transit providing masks for its drivers who are going out in public to meet with people? Are the other employers whose staff must go and interact with the community, are they providing masks? You know what? The narrative changed. Now, they have said, the healthcare professionals still, they have now said that masks are actually vital in the protection of this transmission. That narrative changed. And you know, if you're going to go to battle, even if you don't have a gun, you're better off taking a stick. Don't just go there with hope. No, you cannot go to battle with the enemy with just hope. You better take something. So, I know the government and the health services, they are doing a wonderful job trying to combat this menace. You're doing a good job. Keep up. But more needs to be done. More needs to be done to protect our people. I read with a lot of disappointment that the government is sending protective gear to other countries and to other provinces. And I'm talking about Alberta here. Because apparently we have enough for the projected illnesses. You know? And I'm sitting here wondering, we cannot buy any masks. They are not available for purchasing. Employers are not providing them. There is no sanitizer. We cannot get Clorox wipes even from Walmart unless you go every day to try your luck. We don't have those. But we're sending protective gear out there. Guess what? Charity begins at home. We need first to protect ourselves. We need to put our masks first before we can put masks of our neighbors and our friends. We need to protect our essential service workers. It must start here. I also read with another disappointment that the government is giving projections of how many people are going to die in best case scenarios. And that best case scenario was saying between 11,000 and 22,000 people in best case scenario. Guess what? The people who are staying home, the ones who have luxury, who have the opportunity to work from home, those are not at risk. So the people who have the highest risk, they are our essential service workers. So I tend to believe then they are going to form the majority of those projections. Those are the people we need to protect most because they catch it. Once they go out there, they are sitting ducks, their families are sitting ducks. It gets to be not a matter of if, but when they're going to catch this. You know? And I know you've increased testing, which is a good thing, but maybe we can do something before we get to testing. We can do protection. Maybe we'll need to do less testing if we protect these people and their families, because they catch it, they bring it home to their families, they get sick. Guess what? They go to the hospital. Again, it's a cycle. And when they go to the hospital, they are again now exposing the other essential service workers. So it's a cycle. And the endangered species here is the essential service workers. If we do not protect them, we are not protecting our nation. We're putting them at risk. So please, employers, the government, anybody, Alberta Health Services, if you can provide masks to these people, to the employers of these essential services, you would be saving a lot of lives out there. Again, as I said, they are better off with a mask than with nothing. They are better off with sanitizer than with nothing. So please provide masks to these essential service workers. It's unfortunate. Every day you hear a store, the police today I heard, transit, everybody out there that they're having these infections. Guess what? By the time they're having these infections, their families are at risk. And that is still overloading the healthcare system. Please let us protect our essential service workers. Let us protect them, because each and every life is important. Essential service workers' lives matter, and it is safety first. Before we send them out there, let us ensure safety first, because every life lost, every infection, every compromised person out there who dies out of this is a life too many. It's an infection too many. We need to stop this by protecting our essential service workers. Everybody is scared. They are scared they're going out there. They are doing their duty. They are dead scared. Their families are dead scared. Unfortunately, and I have to say this, our essential service workers, majority of them, they are low income earners, or they are minimum wage earners. And those are the people we are putting at risk. Let us do something for them, because their lives matter.